The cholera outbreak in Haiti has been devastating. It's already killed over 1,000 people, and it has now crossed the border into the Dominican Republic. The two island nations are among the poorest in the region with little or no public medical services.
And St. Francis Hospital sponsors two medical mission teams who travel to countries like Haiti and the Dominican Republic to provide much-needed medical treatment. One team has just returned from a trip to the Dominican Republic and shares their experience with us.
As we grow older, you have to find something to become passionate about. It just keeps you involved in life and it keeps you connected with humanity. And I have found mine, and these mission trips are that for me. And I hope to continue until I can't anymore.
Nurse Kathy Ayers just returned from her 5th medical mission trip to the Dominican Republic.
My role in these trips are to make it happen for everybody in terms of having the available equipment. When you walk into these hospitals, they're basically empty rooms. They might have some shelving in there, but that's it.
The need is just so overwhelming, you just can't. It just kind of mind boggles you when you see how many people are waiting in line for help. The government has only limited resources, so they build these hospitals with wide corridors, fancy labels, blood bank, OR, X-ray. You go in and they're all locked. There's no magic behind the doors. There's no equipment. There's no personnel. So the government, with its meager resources, builds these structures just to give the patients hope.
Dr. Bork was the team leader for the mission trip to the Dominican Republic. The group of 50 missionaries treated over 400 patients in a town close to the Haitian border.
They all come to us because they really have nothing and they can't afford their local care, which they have no insurance system like we do, so it's really on a cash basis. So no, these are indigent people who have no clean water. A lot of them don't have any electricity for most of the day, and the pictures you see on CNN, that's what we treat.
To fill the empty buildings, the medical team brings thousands of pounds of medical equipment. The missionaries are met on the premises by the Medical Ministry International, who supplies the beds and anesthesia machines.
I was in the general surgery room this year, and we did a lot of hernia repairs and some gallbladder removals. One of the more traumatic events was a baby that we delivered who was not doing well at all. And I'm quite sure if we hadn't been there, she would have died.
Among the personnel on the trip were surgeons, nurses, pediatricians, and a dentist.
It's difficult, it's challenging. It's the hardest thing I've ever done because you are responsible for so many things, not just the people, but the patients you serve in conditions that are unimaginable, with things that happen that you can't even dream of, all in a blink of an eye.
The medical team is one of 2 that are sponsored and run by physicians at St. Francis Medical Center in Hartford. Dr. Abe Daoud, who's been running mission trips since 2001, leads the red team, and Dr. Bork leads the blue.
First, it's to take care of as many people as we can in the third world setting to make a difference. Second, it's to build this organization into something here at St. Francis that's sustainable, that will outlast the efforts of Dr. Daoud and his team and our team as well. Because I think that's important that this hospital has a mission program that speaks to doing so much for others. The third goal is to expose as many people as I can who are non-medical to mission life, because it's incredible, even though it's difficult and demanding, and you come back a different person.
The missionaries pay their own airfare and use personal and vacation time for the trip.
It's been incredible. It's made me happier, a better person, a better father, a better obstetrician, just about in every way. It has brought me inner peace to see what we can bring. And now I want to share this with as many people as I can.
Nothing external will satisfy you as what you experience internally in your mind. Finding something to give to others of yourself makes you a much happier person.
The St. Francis Medical Mission teams welcome anyone interested in joining their groups.
If you are more interested in the smile on the other person's face rather than on your own, life is easy.
Dr. Bork is anxious to return to the Dominican Republic and, as a matter of fact, is hoping to go again within the next 6 months with an even larger team.